What do you do if you have a patient in a dental chair who is obviously high? I'm Dr. Arnell Wright.
And I'm Dr. Effie Ioannidou. And today we are having a really great conversation about cannabis and our patients.
From the American Dental Association, this is Dental Soundbites, created for dentists by dentists. Ready? Let's dive right into real talk on dentistry's daily wins and sticky situations.
Before we dive into the episode, if you have enjoyed Dental Soundbites, please help us by rating the podcast on Apple Podcasts, Spotify, or wherever you're listening.
Yes. Please leave us a review. That's going to help us continue to support other dentists and our great profession.
Yeah, absolutely, Arnell. Thank you, guys. Okay, let's talk about cannabis.
All right.
There was an ADA news story about this, right? Some years ago that said that many dentists have had a patient that was high during a dental visit. I have never experienced this, but I'm sure many people have, right?
Crazy, yeah. It surprises me that you haven't had a patient that was high in your chair.
Or not that I know of.
Oh, okay. Okay, so maybe today during our conversation, we may learn some things to look for, because I'm sure somebody has been high up in your chair.
That's right.
I'm sure.
That's right. Right.
And in 2023, the ADA Dentist Trend Report survey found that 46% of the 500 respondents reported seeing more patients under the influence than in the previous year. And that made us want to know, what should you do in that situation? How does it affect your treatment plan? And why are some patients coming in high?
And also this finding tells you that it's not that rare, right?
Mm-hmm.
So it's exactly what we were saying. Like maybe either I'm not that observant.
No, I doubt
or
that.
Or I don't know
the
signs.
Effie, do not do that to yourself. No, we know you're observant. Come on, we know you're Queen Bee. You're observant.
So actually, that's why we have the right guest today.
Absolutely.
To help us get some answers on this topic. We have invited an expert, Dr. Barry Taylor, to join us today. So hi, Dr. Taylor. Nice meeting you. And tell us a little bit about yourself.
The introduction conversation has been great, and a lot of comments I would love to make.
Ooh, go for it.
Which all lead to why I got into this as the expert, so to say. But I'm a general dentist. I no longer practice clinically now, but I did practice clinically up until 2020, and I still have an active dental license, a general dentist. Went to Oregon Health Science University School of Dentistry. But I think related to this, before I started dental school, I did 2 years of research as a research assistant. And the lab I was in, we actually were looking at the dopamine receptor. And at that time, there were 2 dopamine receptors. I think now they recognize 4 or 6. I'm not sure. But at the time, there was the D1 and the D2 receptors. I just kind of had that in my back and went to dental school, graduated from dental school. And then what happened was about 2016, I read an article in a well-respected dental magazine. It wasn't a peer review, but it was just kind of a article about what you should do if you have a patient in your chair that is high.
Okay.
And in that article, it made reference to the fact that if that patient has used marijuana like within the past 7 days or something like that, you should not treat that patient. If they're at risk of infection, you shouldn't treat that patient. And I read that, and having grown up in Oregon, having gone to undergraduate in Oregon, having gone to dental school in Oregon, I'm sure the first patients I treated that were under the influence, that probably started in dental school. Mm-hmm. And I read that article, and at that same time was when Colorado, Washington, California had already legalized it for medical reasons. Oregon was coming on board, legalizing it for recreational reasons. And I just really wanted to develop a program of educating dentists, dental hygienists, dental assistants, anyone in the oral health profession, that they would feel comfortable talking to their patients about marijuana use, cannabis use, but have it come from a scientific, evidence-based background.
Absolutely.
And going back to that article that I read when I was reading something about, you shouldn't treat a patient for 7 days, there were just some ridiculous statements. I really wanted to educate oral health professionals so that they would feel comfortable treating patients and be as comfortable talking to their patients about marijuana use and cannabis use as they are about tobacco use or alcohol use or opioid pain, any of the other medications, substances that our patients are under the influence of.
I love that. Can I just chime in really quickly? I'm so glad that you said like you wanted to develop like an education program, because I don't know if y'all saw my face about like when you said you shouldn't treat anybody, like when you read that article, I was like, because I'm like, whoa, well, more than likely I probably have done that on a very, very regular basis. And hopefully, you know, the authorities won't come and get me. But still, is that still a recommendation?
No, absolutely not.
Ooh,
absolutely
hallelujah.
not.
Thank God.
No, not at all.
Update us.
You know, when we talk about recommendations, and there's kind of two different issues, because either and I would say it's somewhat similar to how do you treat patients who have used alcohol?
Right.
You know, if it's 4:00 in the afternoon and your patient tells you that they had brunch and had a mimosa or a Bloody Mary with their friend at breakfast at 9 a.m., are you still going to treat them that afternoon? There's two things, you know, for consent and whatnot, you're going to use your professional judgment to make a judgment call as to, are they coherent with me? Can I have an intelligent conversation with them? Are they answering questions, so on and so forth? And then the second factor is you're going to take vital signs. And I think that's with cannabis, I always go back to the importance of taking the vital signs. And then also that gets into a discussion of the difference of asking questions. And this is where I want the doctors and hygienists and assistants, everyone to be comfortable asking the questions is, you know, did you smoke it? Did you take an edible? Is it a 3:00 afternoon patient and they wake and bake, so to say, and it's a 25-year-old who does that every single solitary morning, but they did that in the morning and now it's an afternoon patient? Or did they take an edible in the parking lot at noon because they want to be relaxed for the dental appointment at 1:00 or 2:00? So
that's right.
I always say, how did you consume it is how I ask patients.
That's a critical thing. That's a critical thing, because when we smoke it, a quick onset of action of about 30 minutes, peak action about 30 minutes to 45 minutes, and then on average, a duration of action of about 2 hours. You know, we're talking averages here, and it affects everyone differently. But when you start talking about an edible, and all of a sudden you're talking about a range of onset of action, which could be anywhere from 1 hour to 3 hours, where that peak action is for the patient, much, much more variable. It could be at 2 hours. It could be out at 3 or 4 hours. And then I think really the concern with an edible is a duration of action that can be as long as 6 or 8 hours. So asking the patient when they took it, I think almost more importantly is what form did you take that in? Did you take it as an edible or did you smoke it? Because you're going to have very much different dynamics for how it's affecting the patient.
But I think what you said was very right. It's how we train practitioners and staff to feel comfortable asking these questions, right? There is this kind of it's the stigma, the taboo of, you know, no, that's not my business. I don't want to go into this for several reasons. Like we are not trained for this. Maybe we feel, you know, we don't want to touch any legal liability thing. You know, it's so complicated.
Yeah.
Dr. Taylor, is cannabis use, from your experience and expertise, is it increasing overall? And if so, could you just let us into a little bit more why that is?
It is. As it becomes legal in more states, and I think now we have 23 or 24 states, District of Columbia, however we're going to count them, to where it is legal for recreational use. You have, I think, 36, 37 states where it is legal for medicinal reasons. And you really only have, I think, 3 states where there is absolutely no use of marijuana or cannabis in any manner. The other thing that's interesting when we're talking about it is that it's not an increase in use among teenagers and whatnot. That actually hasn't increased in the manner that you would maybe think it would as it became legal in states. The greatest rate of increase of use of marijuana for THC is actually in the older population, over the age of 55.
I can believe that, actually.
Yeah, and people will sometimes say like, oh, well, of course, you know, those are all the hippies in the 60s. Well, actually, no, those people are actually in their 70s and 80s. It's the reason why is hypothetically is that more and more people are using it for a perceived medicinal reason and not for a recreational reason.
Interesting.
I can believe that.
Yeah. I'm 55 and I can tell you, I'm no hippie of the 60s. I was born in 69. So these people that say the hippies of the 60s don't do simple math.
Right.
I hope it wasn't
Simple
offensive
math.
for me to say I can believe that. I think I was saying it from
not
an
at all.
experience.
No. You were absolutely
Well, no,
right.
I was just going to say from an
for
experience
sure.
perspective, seeing some of my patients, like they talk about like anxiety and they're just like medicinal users. Exactly to your point, what you said. So like, And I feel like it's just becoming less taboo. It's almost like stigmas around, mental health things. People are just being more open and talking about it on a regular basis now. So I really love this conversation we're having.
I think the stigma is a good word. I mean, I'm talking about the scientific terms of, reduced rate of safety and how people view it. But yeah, it's the stigma. That's the word that sums it all up.
Yep. I mean, I really want to go back to what you said about the, if you will, the list increase that we see in the teenager, young adults probably, because, I don't know about teenagers, and I would predict that with the vaping and everything, perhaps they're combining those two. But for young adults, we always know that 4 years in college, if you don't experience this, then you're not considered cool, right? So has been a common use for ever and ever and ever, for decades now, right?
Very much so. Yeah, and I think going back to the kind of the original question and everything is, because this is about patient education and communication with patients, is the reason why I like to talk about that older population using it is that when a patient is sitting in your chair, and yes, statistically, the highest heavy consumers are, age 20 to 25, 16 to 20, the young male, that is your classic true. But having said that, you need to ask every patient, because it's your older patients can not as likely, but they very commonly can be using it.
I feel like my older patients, they just come outright and say it. Like, it's not no hiding it. They are like, it's on Front Street.
Right.
Yeah. And I feel like when we have conversations about it, it makes it less like weird to talk about it.
Yeah, you're right.
So if I suspect that someone on my dental chair is high, what's the first thing that I need to do, and what's the right way to approach this patient?
Well, the first question is to say, hey, I notice you have dilated eyes, or, I can smell cannabis on you. But if they've used an edible, you're not going to have that aroma. The first thing I'd flat out ask them. And then I think, and I hope every single solitary dentist, hygienist, oral health provider, well, particularly with hygienists and dentists, that we're taking their vital signs.
Yeah.
So that's going to be the other thing. So if you haven't, you take the vital signs, you're asking them in a nice conversation manner, have you used cannabis today? And then you want to know, going back to our earlier conversation, when did you use it and how did you use it? Hopefully we'll be honest with you. If you're suspicious they've got dilated eyes or they seem a little incoherent, then that's a check mark of, okay, I'm not going to proceed with treatment because my professional judgment is picking up that something is off here and I need to know what is off. But if they are honest with you and they tell you that I just took an edible an hour ago, that's where you need to be educated. Like, I'm not too comfortable. Or, maybe like, okay, like how many milligrams did you take? How often do you take it? Oh, it's the first time I've ever used cannabis. My friend suggested it to me and said I should take 10 milligrams because it will help me relax. I've never done this before. Well, no, that'd be a red flag. And I would absolutely be like, no, have someone drive you home because there is an increased risk of motor vehicle accident. You're under the influence. I'd be very, very concerned about it. If it's someone who says, I took 5 milligrams every night before I go to sleep, I thought it would help me relax for the dental appointment. I took 5 milligrams. I take the vitals. I'd be more comfortable treating them. And I think they're in the Journal of the American College of Dentists is 2010, Dr. Peltier, a well-respected editor for the journal, he wrote a really good article in that issue. And it was about, it's not ethical to have a blanket statement around cannabis use. Like you can't just say like, if you have used cannabis within the past 24 hours, I will not treat you. There's not really evidence to back that up, either from an ethical standpoint or from a scientific standpoint.
The nature of our job is so hard. Like we have to shift in between decisions, and it's like case by case. As much as like I say this all the time to mentees,
right? As
much as I'd like to have like blanket statements for certain things, it's like it depends on the data that's in front of you at that time. Like I don't know. To your point, I hope that that's like adding value to our listeners.
Yeah, no, for sure.
Well said. It's very well said. I think dentists, I think all providers want those black and white statements of, this is the path to take. And that's why we go to dental school with the professional judgment.
Yep.
We have to make some judgment calls.
Absolutely. For sure.
Yeah. Okay. So let's say that my patient admits that they are high. How does that affect my treatment plan? Maybe we can go into a little bit more background about cannabis and all of that, like anything that you have to add.
Yeah. So when we talk about cannabis and marijuana, we tend to use the two terms interchangeably. Cannabis really is referring more to the plant. So a cannabis plant could be very, very high concentrations of CBD, and CBD is cannabinoid, which is not psychoactive and has low affinity for the CB1 and CB2 receptor when we start talking about the endocannabinoid system. When we talk about marijuana, we're tending to talk about the cannabis plant, which is high in THC concentration. And so it's like when we talk about medical use and recreational use and going down a rabbit hole a little bit, if someone is using cannabis for recreational reasons, they are probably using it with a high THC concentration. If someone is using it for medical reasons, you really need to ask are you using cannabis with a high CBD concentration? Because that could have zero effect on our dentistry. Or other people are using marijuana, cannabis with a high THC concentration and saying they're using it for medicinal reasons. Did I take us too far down a rabbit hole? That was a lot.
No.
That was a lot to wrap my head around, but this was good. I feel like our listeners, they actually need this. Like even me, I was just like, okay, wait, let me just write a few things down here. Let me get some notes, The
bottom line is that if a blanket statement of, yes, I use marijuana or yes, I use cannabis, that's why I want to educate. And that's why people listening to the podcast too, oh, okay. So do you use it for the high THC concentration or do you use it for a CBD concentration? Then more probing questions of, how often do you use it? And when do you use it? Do you use it as an edible or do you smoke it? So kind of two different paths, but going back to conversation with the patient.
We'll be right back.
Need a snack to pair with your podcast? Grab something from your new fridge. ADA members get member-only savings on select GE appliances, including Profile, Cafe, GE Monogram Hire, and Hotpoint appliances. Visit ADAmemberadvantage.com/GE to get the special authorization code to access your savings. Get up and get moving with ClassPass. ADA members will save 15% on credit packages you can use at top studios and gyms across the country, including SoulCycle, Core Power Yoga, F45, and Pure Barre. There are also on-demand audio and video workouts that include strength training, cardio, stretching, meditation, and more. Visit ada.org/CP to learn more.
Welcome back to Dental Soundbites. We are having a conversation with Dr. Barry Taylor about the impacts of cannabis on oral health.
So how does cannabis specifically impact oral health? And what do we see with the chronic use of cannabis? And is there a difference between patients who smoke versus consume it as edible?
Yeah, they have a few hours. No, all great questions. I think what the quickest and easiest one to explain is it causes dry mouth. Now we're talking about marijuana, THC. So I may have said this already. CBD has this weak affinity for the CB1 and CB2 receptor. THC has a high affinity for those receptors. And so it decreases salivation. And it does it through a number of ways. It decreases the singling within the cells of the salivary glands. It relaxes the muscles around the salivary glands. And it also decreases the innervation and the stimulation of the salivary glands by changing the neurotransmitters at the nerve ends and whatnot. So a number of different ways, all those ways, they all cause decreased salivation. I was just lecturing at the dental school today. That's why this is so familiar to me. And it's on a number of the different strains. The number one negative effect is dry mouth. So getting dry mouth is incredibly common from using THC. And you're going to get that whether you're smoking it or if you're using an edible. And then we all know xerostomia, of course, is going to cause caries. That's a given. And so then there are a number of studies. The best one is actually out of an adolescent program in Nevada. I think it's the most extensive one, but showing a very significant increase in dental caries. And then that kind of leads, because of that xerostomia, and it leads to the second thing is that THC, you get the munchies, right? We all, I'm sure you've heard people joking about getting the munchies when they use THCs. So that's caused by, there is a hormone protein called leptin, which is released by fat cells. And so the normal process is we eat a meal, leptin is released. Leptin tells our brain that we are full. We don't eat anymore. Cannabis inhibits leptin, so the brain doesn't get that message. And then another thing that THC does is it increases in certain areas in the brain, it increases the release of dopamine. So now all of a sudden, sweeter foods taste, more sweet, salty foods, Wow. So you develop this craving for unhealthy foods. There's no message in your brain saying that you're full. So this whole joke about getting high and getting the munchies. And so these high sugary foods, soda pops and whatnot, combined with dry mouth, you have like the recipe for dental caries.
Absolutely. It's exactly the recipe.
Yeah.
The next one is a little bit more, you don't have that same cause and effect, so to say. But when we talk about periodontal disease, so there's a great study out of New Zealand. I mispronounced the name. I think it's the duodenine study, but 3 papers were published in different journals on the duodenine study. And this was a large general population study, meaning that they were taking a large cohort of people and then every 4 to 6 years doing full health exams on them. So this wasn't a dental study. This was a study looking at heart disease, lung, everything, just the general health of the population. But we were lucky because they were doing periodontal disease, periodontal probings and measurements in that study. So you're following this population over a number of years. Mm-hmm. And now that study, 3 papers have come out of that showing that the increased prevalence of periodontal disease. And actually kind of the lighthearted thing that you saw some headlines in popular literature was that periodontal disease was actually the only disease that showed a correlation to smoking THC cannabis. There was no other disease that showed a correlation with increased use of THC. And then a similar study was done in the United States. It's called the NHANES study. Very similar, but the same conclusion after that study was that those people that smoked cannabis increased clinical attachment loss. So, you have 2 very large studies with large N's showing a prevalence of periodontal disease in those people that use cannabis. And the important thing there as well is that was for people that were smoking marijuana. So we don't know if there's a difference, like between using edibles versus smoking it. And then it comes back to smoke is smoke and smoke is bad.
Yeah.
Exactly.
The damage it does to the micro vessels and everything. It comes back to, you can't say so much that maybe it's the THC, the marijuana causing the periodontal disease, but it comes back to is smoke.
Right. So good.
Oh, for sure. And I'm sure perhaps it also goes back to the etiology and the microbial profiling of these patients. But, it's so interesting.
Complex.
Yeah, for sure.
Yeah. And then the 3 big categories of oral health. And the third one is around oral cancer.
Yep.
Mm-hmm.
And there are probably equal number of studies showing a positive association between THC use and oral cancer. And there are, I would say, probably even more studies showing no association between THC and oral cancer. The one exception to that is with laryngeal cancer, positive association with that. But there is a study actually showing that there's actually was a decrease in oral tongue cancer from that population that was using THC. Mm-hmm. But that's hard to study oral cancer because I don't know, when I was in dental school, they told us oral cancer was like 3% of all cancers. I don't know the exact statistic, but it's a very small population that gets oral cancer. And then of that small population, you have, let's say 10% that are using marijuana on a regular basis. So it's such a small population sample. It's hard to study that.
Yeah. Well, speaking of studying, are there any specific guidelines or recommendations for the use of cannabis in medical or dental patients that our practitioners should be aware of?
I say this a little bit cautiously because this is just Barry Taylor speaking after reading a lot of articles and everything. I think there's something to be said for using edibles versus smoking it because we know the damage from smoking it. When you smoke it, you also have that increased airway retention. You're inhaling it. You're trying to hold it in. We know all the damage from smoke, whether it's tobacco or cannabis or anything. Right. So I think there's something to be said for using it as an edible and not smoking it. I think a lot of it then is patient communication. Your patients your college patients or whoever may think it's kind of funny, the increased appetite and everything, but they may not put the connection between, oh yeah, I do get cotton mouth, dry mouth every time I use THC. Mm-hmm. That's where the education comes in. Like, oh, hey, you get that dry mouth. You're also eating a lot of sugary foods in your oral health care, increased caries and whatnot.
Yeah.
And I think it's all things in moderation, just like alcohol use or a lot of other substances. The person who's using an edible Friday nights 2 or 3 times a month, I'm not the least bit concerned about. I'm concerned about the person who is smoking cannabis on a daily basis. And then, we haven't talked at all about cannabis use disorder. And there is a cause and effect there with dosage in chronic users. It's not a completely safe drug. Depending on how you look at it, about 20 to 30% of the population will develop some degree of cannabis use disorder. The population that uses cannabis, different ways to measure it, different studies, but I think it's pretty safe to say 20 to 30% will develop a degree of cannabis use disorder, anywhere from mild to severe. Centers for Disease Control will say that 10% will develop an addiction. So I think it's safe to say that probably 10% will develop an addiction, severe problem with it, but as high as 30% will develop some degree of a problem with it. And again, the other thing that's important is that we're talking about THC.
If we want to think about the bottom line of our conversation, how would you summarize the bullet points for us, Dr. Taylor?
Right. Being comfortable to talk to your patients, finding out, are they smoking it? Are they using it as an edible?
That's right.
Clarifying with them, are they using products which have, marijuana, high THC? So are they using it to the degree to get that euphoria, that intoxication? Or are they telling you that they use cannabis and it is just, CBD gummies that they bought on Amazon? So really making sure you understand and clarify, is it CBD or THC? Because two different paths there.
Yep.
And I really think at the most basic level, the most common one, is the dry mouth and the connection between dry mouth and dental caries. And if they're smoking it, then how often? Because it'd be the same conversation you have with a tobacco user.
Yep.
About periodontal disease
And cancer.
Yeah, very much so. Exactly.
I mean, this was such a useful conversation. I learned so much.
So good. I'm over here still writing notes. I'm like,
I
wait,
know.
let me jot that.
You two are great. You two are great. You two are great.
I'm like looking forward to have a patient who is high.
Listen, you might
Now
not get
I'm
any.
ready.
You might not
I'm
get any work
ready
done.
to go.
You might not get any work done.
Yeah.
If it's someone who has smoked, if someone who has smoked cannabis and you've taken the vital signs and it's been a couple hours and the vital signs are fine, there's not huge medical emergency risks with someone who has used cannabis.
Oh, very good point.
On the next Dental Soundbites.
We're bringing back one of your favorite topics, sticky situations.
This time we are focusing on respect.
Tune in for strategies for cultivating respect in our work relationships and building a better work environment.
Thank you so much, Dr. Taylor. This was meaningful. This was very educational. I'm prepared.
Yeah.
Yeah, thank you both.
Yes, we're so glad that you are
Thank
here
you.
with us.
Yeah, thank you for the opportunity. It's great.
Oh, of course. Now tell us a little bit, where can our listeners find more about you, or where can they follow you online if they want to?
Yeah, I don't have any presence online. I'm the executive director for
Wow.
the Oregon Dental Association. Yeah, I'm the executive director for the Oregon Dental Association. So I don't have any online presence or anything. I'm going to send you a website. It's called STEM, I think is what it's called. But it's a pretty good website for information on cannabis, and it's all evidence-based and whatnot.
Okay.
Beautiful.
We can share with our listeners so they can have at least the resources to get more educated. That's great.
It's just a good resource for that information.
Yeah, that's great.
We do want to tell all of our listeners, if you like this episode, please share it with a friend. Then be sure to subscribe to this podcast wherever you are listening so that you can get the latest episodes.
And don't forget that you can also rate the episode, write a review, and follow us on social media.
Yes. And last but not least, the conversation does continue in the ADA member app and on our YouTube channel. Catch all of the bonus episodes and the bonus contents and the moments that you didn't get to hear on the show.
Thank you for joining us. Dental Soundbites is an American Dental Association podcast. You can also find this show, resources, and more on the ADA member app and online at ada.org/podcast.